Hello, everyone. I'm Tanya Rivero. Thank you for joining us. President Biden is focusing on health care today as the country remains hard hit by the coronavirus pandemic. Mr. Biden signed executive actions reversing anti-abortion rights policies. He also signed an executive order allowing healthcare.gov to open for a special enrollment period. The president believes the move will undo the damage done by the past administration.
There's nothing new that we're doing here other than restoring the Affordable Care Act and restoring the Medicaid to the way it was before Trump became president, which by fiat he changed, made more inaccessible, more expensive, and more difficult for people to qualify for either of those two items.
For more on all of this, let's bring in Sean Sullivan. He's a CBS News political contributor and White House reporter with the Washington Post. Hi, Sean. Great to see you. So break down for us what is in these executive orders on health care. As we know, we've seen the president sign a series of executive orders over the past several days, each one with a theme. Today's theme is health care. So what did he do today? By the way, I'd like to note that he made a point of saying, this is not any new legislation that I'm crafting. I'm simply reversing other executive orders that were signed by President Trump. I guess he's addressing some of the criticism that's been floated recently that perhaps the president is signing a few too many executive orders, correct?
Yeah, that's right, Tanya. I also found that very notable, the fact that he was underscoring that, because we're already seeing, as you mentioned, criticism a lot from Republicans that Biden, the president, in his earliest days here, is relying too much on the power of his office, the power of executive fiat. And of course, we have seen him on a number of different fronts, from climate change to the economy to battling COVID, sign these executive orders. It's almost becoming sort of a daily ritual at the White House. And today, in this latest set, we see sort of a couple of main things happening that President Biden is doing. One is he is opening the online marketplaces through the Affordable Care Act to allow people to buy insurance through these online marketplaces. Normally, these marketplaces would only be open for a limited period of time at the end of the year. But the message he is sending with this is, look, there are people who are out of work. There are people whose healthcare situation has been cast into flux during this pandemic, and they need healthcare, and they should be able to sign up if they need this. So from February 15th to May 15th, people are going to be able to, in many places, sign up for healthcare through these exchanges. And it's also notable that these are sort of two of the issues that he underscored when he ran for president: battling the pandemic and also bolstering the Affordable Care Act. It was something he campaigned on repeatedly in the primary and also in the general election. We're also seeing him move to revoke the so-called Mexico City policy. This is a policy that has divided Republicans and Democrats. We've seen the law sort of go back, the rule go back and forth. You know, we saw President Obama revoke this. We saw President Trump reinstate this. Now we're seeing Biden revoke this. This is a law. This is a rule that effectively bars foreign organizations from getting federal funding if they are using funding to promote or perform abortions. And so Biden is reversing that. That's something that abortion rights advocates are going to be cheering. But already we're seeing criticism from Republicans and from anti-abortion advocates of this move. We saw Mitch McConnell, the Republican leader, the minority leader in the Senate, criticize Biden for that. We also saw him, as we've seen other Republicans, criticize Biden for relying too heavily on executive orders. So this is a theme that is something to watch in the coming days as Biden continues to take these executive actions, Tanya.
Absolutely. And Sean, the president, who of course was vice president when Obamacare was enacted, did vow during his presidential campaign to protect and expand the 2010 health care law. So, Sean, tell us, what is the current status of Obamacare? We know that it has been battered and maligned under the previous administration, but it is still standing, correct? What's the status?
It is still standing, and it has faced numerous legal challenges over the years from Republicans. This is part of the reason why this was such a big issue in the presidential campaign. And really, in the last couple of election cycles, we've seen Republicans and Democrats really do battle over this issue. You know, if you look over the years, this was something that at the very beginning, right after President Obama was able to pass this law, Republicans felt they could go on offense, that they could use this law to campaign against Democrats. And they were effective in a lot of cases. But as time has gone on, The law has become more popular. It has withstood all of these legal challenges that Republicans have waged against it. And now, with President Biden in office, you have somebody who is vowing not only to protect it, but to bolster it. And we're seeing him utilize that right now. So given the popularity of the law, you can understand some of the political incentive here for President Biden to do this. And again, also it gets to what he vowed to do during the campaign, which is to use the power of his office to battle the pandemic. And so that's why we're seeing this today. But again, we are seeing criticism of his actions from Republicans. And so it's worth watching in the coming days and weeks how that plays out, because this is a president who has vowed to be a unifier, somebody who's vowed to work with Republicans to foster bipartisanship. But we're already in the earliest days seeing some criticism from the other side. How does he respond to that? What does he do? Is he able to foster any, sort of working relationship with Capitol Hill when it comes to actually legislating? That's a big question right now as we see a lot of these executive orders go through.
Sean, and I want to touch on something a little bit further that you mentioned at the beginning, which was that the president also issued today a presidential memorandum unwinding the Mexico City policy. We're hearing a lot about it today, but, our viewers may not be as familiar. And we spoke with a representative from the UN earlier who works in international women's health. And she made the point, I think it's important to point out this isn't, a policy. He's now not enacted a policy that, allows the U.S. to willy-nilly fund international abortions. That's not what it does. But she said as part of women's reproductive health within the country, they follow very closely the guidelines of each individual country, but within the country and within the circumstances where that might be necessary, they help women, with safe and effective reproductive care. So I think that sometimes this Mexico City policy becomes very narrowly focused on one thing when it's really just a tiny piece of what, international women's health advocates are trying to get across.
Yeah, a lot of women's health advocates talk about this policy and have talked about it over the years. And they look at the Republican efforts to reinstate this, to implement this, and they've argued that that is an unnecessary and a position that bars a lot of these groups from helping women all over the world. And that's why we've seen this be a very sort of divisive issue politically, because the issue of abortion does come up a lot when this issue is debated. And it's something that I think will continue to stoke debate, just as we've seen throughout history. You see a Democratic administration, the Obama administration, rescind this. Then the very next administration reinstates it. Now another Democratic administration comes in and revokes it again. And so we've sort of seen the country go back and forth on this, and it has sort of become a divisive issue. It's notable that McConnell, as we talked about earlier, the majority leader, mentioning this on the Senate floor in a speech today. This is something that I think for the Republican base is meaningful to them. But this is an issue, as you point out, Tanya, that women's health advocates have pointed out is something that goes well beyond the scope of abortion. That in the political debate here in the United States, that has become the focal point of this rule when this has been debated and when we've seen administrations go back and forth on this.